Well done. Thank you. I believe if you're an ASL student, if you don't mind closing your camera, it was nice to see some of you from my classes. I took a quick glance. I appreciate that. Okay, we're going to go ahead and get started with our meeting. It is 6:00, well, the last time I looked, it was 6:08, probably 6:09. Anyway, we'll say 6:08. We do have 5 commissioners, so we have a quorum. We are able to vote. If we only had 4, we wouldn't be able to proceed. My name is Tim Riker. I'm the chair of this board. Let's go down the list of who's here. We have Caroline Olbrecht. We also have Brett Hayes. We have Betsy Beach. She'll be our secretary, is our secretary. We have Brett Hayes. And we have Kimberly Marthers. So we have met our quorum. Also, we have some staff here today. Betsy, go ahead. Oh.
Betsy, we can't hear you. You're muted.
Unmade just got here, so we have 6 commissioners.
Oh, Boomy.
Boomy.
Thank you. Right. Thank you. So we have Boomy Osho. We can go ahead and proceed with our meeting. I wanted to mention that we have staff here tonight. We have Ernest Covington III, our executive director. We have, I'm just looking at the names. We have Bethany Lenk, who is helping us with this meeting, facilitating this meeting. She's our Zoom guru. We have Christine West. She's the director of the HSTP project. She's a coordinator for our health system transformation project. And we have Holly St. Pierre, our interpreter referral specialist. And we have Mike Bear, who's responsible, he's our director for emergency public communication access. So we're ready to go ahead and get started. Let me just double check our agenda. If anyone does have a public comment, this is a great time to make that comment. You can type it in the chat. And then if you'd like to make your comment, that's fine. If there's time later for you to make that comment, that's another possibility. So like I said, just chat to me or to Bethany, send a chat, and we'll make sure to capture that. I don't see anything right now, so we'll go ahead and move on with our agenda, start our meeting. October 21st, did everyone have a chance to read the minutes? Are there any suggested amendments, modifications, or would somebody like to move to accept those meeting minutes? It seems like there were no misspellings. I don't see any suggested changes. Okay. Bethany just said, if anyone wants to open their cameras at this point, that's fine. We have already posted a draft of the minutes. So we did do that. After tonight's meeting, if any changes are made, we'll post a final draft. Betsy, yes. Oh, turn on your camera, Betsy. I mean, your.
Muted. I'll move we accept the minutes from October 21st as written.
I'll second.
Carolyn Obrecht seconds. Okay. So if we could just have 4 people visible at any given time, that helps with our quality. Thank you. Great. So all in favor to accept those meeting minutes, please just go ahead and vote. You can either do it in the chat or otherwise.
I'm doing, this is Caroline, it's just me doing it otherwise.
Okay, and Kimmy. Great, got it. Brett, got it. I see some in the chat. Is somebody speaking? Who else has voted?
Yeah. Yeah.
Yeah, so don't forget to mute folks, just so we don't have any background noise. Who else is eligible to vote? Have I missed any votes? Okay, so I think there are 2 more people who haven't been counted yet. Carolyn already voted to accept the meeting minutes. Well, she seconded, which is a vote. No one else? Okay. Can you ask your boss to come up and get me online? Thanks. I don't know what happened. We need to hear from everybody.
Tim, I would have loved to vote, but my name is not on that October meeting. It looks like I missed it. So I don't think I can vote since I wasn't there.
I understand. Okay, thank you for explaining that. I appreciate that. Well, my vote would be a 4th. Carolyn, you seconded. I guess
So
we could call that.
Actually, Boomy, your name is on the 21st as having been at the meeting. So you, according to this, you could vote.
Oh, okay. If that should be the case, I vote. I don't know how I missed it. I read it on my email, but I don't know how I missed my own name.
All right, let's see. Let me just count those votes. Yeah, we have 7 votes. 7 of us showed up at that last meeting, so that passes. We can move on to the next item. Let me just see what we have. Thank you. Oh God, that's okay. We want to hear some reports. We have several very important topics tonight and information that we'd like to share with you. So Ernest is asking to do screen sharing. Do you want to do Ernest, Simon, or do you want me to? You need to turn on your microphone.
Bethany, do you mind sharing the screen, please?
Top one. Yeah, thank you.
Yes, give me just a moment. I'm trying to pull up you want the agenda, correct? Give me
Yes,
one moment, please.
Oh, it's gonna be great. Bethany, when you have 2 seconds, if you could let me in again.
And then you'll have to mute that one.
Yeah, I'll turn it off.
Once,
Yeah, I don't need any.
Okay, great. I think we're ready.
Great.
All right.
Thank you. My hero. Computer audio.
I can't seem to see the interpreter. Okay, so I'm going to proceed anyway. The first thing I wanted to say was that, I want, hold on one second, please. I can't see myself.
Oh, that's weird. Yeah. I'm just looking if he does gallery
And
view.
something just happened because now I only see Carol Fay.
Oh.
Bethany.
Gallery.
Now I got Ernest back on. Okay, thank you. Okay, are you ready? Okay, so first of all, I just wanted to say I'd like to give a warm welcome to Commissioner-elects that it's not official yet, and that is going to be
Drew Bosley.
Drew Bosley and David. So I want to welcome the two of them. Thank you for attending tonight's meeting, and we're hoping that the governor right now is processing your recommendation, and so I just want to extend the congratulations to the two of you. And first of all, what I would like to do is explain is the budget situation that we're now facing. Now, as you all know, the budget was supposed to have been passed back on July the 1st, but because of the pandemic, there has been a delay in that decision. Legislation has not passed our budget yet for 2021 as of now. So we're a little behind about 6 months. So we are still using the budget from 2020. And we've been operating on that. And yes, it is pretty scarce in terms of what we're working, but fortunately we have some grant money. And the COVID funding that was there was COVID relief funds. So we have I made a request to have some of that money given to us so that we can budget it in terms of what we need that were related to COVID, such as laptops, interpreters, carts, filming and stuff like that, editing and so forth like that. So some of the grant money was also utilized for that. And this was based on an emergency situation. We haven't really been spending a lot of that money. We've been very frugal about spending that money because we're trying to finally get that 2021 budget passed. And legislation is now starting to vote on it as we speak. They're starting to identify. I'm beginning to see some of the approvals for it for 2021, but it is not officially voted upon yet. So that's still in transition. It's been amazing that it's been 6 months behind. And of course, we have faced a lot of challenges, but nonetheless, we are still proceeding. Now, we thought that the budget would be quite, cut by 15%. So I'm keeping an eye on that because 15%, if it were to be cut, then basically it would impact, a lot of people, losing their jobs through COVID. There's a lot of people that, are not collecting benefits and so forth. And so we're not the only one that's facing this situation. The entire state is expecting a 15% cut in its operation. So we're actually right now identifying what's going to be cut and then deciding what other things that we're going to keep based upon its priority. Now, this is not going to affect our staffing, that I can assure you, because we're going to keep our staffing, but it may cut, certain things like travel expenses, which really doesn't impact us because we really don't travel that much. So it's going to be very, minor cuts that's going to impact us in terms of what we cut. Okay. However, we are going to wait upon, the governor making the approval to find out exactly what is going to be cut. Okay. Now, whether it's going to be a 15% cut or not, we don't know, but I will let you know some good news though. The governor does notice that, that the general, revenue that's
Revenue.
been coming in, when they look about the expenditure, they found out that we haven't really been spending a lot of money. So when it comes to the revenue, our agency has been spending very little of it. So that means we're still gonna have a lot of money there, okay? Because, they realize that among all the state operations, we're being very conservative how we're spending our money and very wisely, and the governor sees that. So we haven't really gone into the red or anything like that. We're within budget. So that's the good news. So we're hoping that that's going to fall upon a good decision. We'll see how that transpires in terms of how legislation will approve that budget for 2021. And then therefore, once that's approved, we'll basically know what's going on. But I just want to inform you that as we speak at this moment, we are operating on a 2020 budget. And I expect to hear something by the end of this week. Hopefully it'll be passed. And they will keep us notified. And then once we do, we will transition into the new budget of 2021. So, and that would be awesome. Now, the next thing I would like to discuss is the COVID-19 update. I have Mike Beer here. And so since Mike Beer is here tonight, he can basically explain what the updates are. I do know that as of now, we're, into a lockdown again. And it's sort of a little bit of a lockdown. And we start to notice that, Rhode Island's now came in #1 in terms of the high positive spread and spike. That's what the numbers going on right now. We are #1 in the world right now. And so that, unfortunately, that means that, it doesn't look like the pandemic is going to, go away anytime soon. Okay. It also is, we're waiting for the vaccine to come, but unfortunately, we don't know when that vaccine is going to be available. But when that vaccine is made available, we will let everyone know. And so we're basically we notice that the interpreters are on the front line. And so we feel that perhaps maybe the first point of service when the vaccine is given out, that it should be with healthcare workers, doctors, medical staff, and so forth. They are the frontline workers. So we feel that interpreters should be included in that as well, since they would be there. And that's been included in our draft. And that's in development. So, I want to thank Bethany for that, because she made sure that that went out with that interest that we were concerned of having the interpreters included in that. And then that was submitted to the director of Dr. Alexander Scott. And if she does acknowledge that the interpreter should be a part of that frontline worker, and that vaccine becomes available, then the interpreters will be included in that care for the first recipients of the vaccine. So right now, I have a meeting that's going on, the National Agency for Deaf and Hard of Hearing Agencies throughout the entire United States. We had this meeting and we were talking about the vaccine for the deaf and hard of hearing and the deaf blind and those with hearing loss, to see how, how this was going to pan out. And how was that we were going to get this information disseminated about the vaccine to our population, and what the process would look like. So we were discussing that, because we need to develop some type of protocol, how that's going to pan out. So what I would like to do is for Mike Bear at this time to elaborate on that a little bit. So Mike, if you don't mind, do you want to share what you know?
Okay, I'll get this, Simon.
Okay, Carol.
Can't see myself, Bethany. Okay, now I can.
Would you
Thank
like
you.
me to stop screen sharing?
No, we're good. Yeah, actually, yes. Nice to see you all tonight. Oh, wait, something just happened. Okay, now I can see you all. That's even better. Thank you. But I can't see myself. Oh, well. Wait a minute. I'm sorry. I'm gonna. Okay, the interpreter's all set, so I am gonna go ahead. Once again, hello, everybody. Good evening. Ernest, thank you so much for your summary about the budget. Everything you said is absolutely right on the money. I wanted to share a few things with you tonight. Now we are on pause. Rhode Island is on pause for 2 weeks. there are a lot of restrictions. And that pause is supposed to end this Sunday, December 13th. But given the fact that Rhode Island has very, very high positivity rates per capita, when you look at the general population, if you think about the number of people that are positive in Rhode Island, we are number one. And so the governor at her press conference tomorrow, I suspect that she's going to extend that pause for 2 to 4 more weeks. It's possible there will be more restrictions as well. So keep an eye on that tomorrow. I'll be watching that for sure. And whatever's new, whatever orders there are, whatever restrictions may be imposed, we'll make sure to get that out to the community in American Sign Language. I haven't done a vlog in the last couple of weeks. Things change so quickly, but I wanted to wait until tomorrow's press conference and give you the most up-to-date information, which I will do. I do communicate quite a bit with the community support team. We call it the CST. We send out emails, and I know those of you who are on my list are receiving those emails. And I know they've appreciated that information because they then communicate it to their constituents in the deaf community. Another thing I wanted to mention, with the numbers spiking, I predict that more deaf and hard of hearing people are going to want to be tested. I got 3 or 4 more phone calls of people who want an interpreter at the testing site. I've contacted Lingua B. That's the national interpreting service. It's a nationwide service to recommit with our agreement that we established months ago. They provide VRI to any deaf or hard of hearing person at no cost who wants to get tested. So some of you have maybe seen this through our information. You can get tested, and we'll explain to you how you can request an interpreter so you'll know that you're going to have an interpreter. Also, you may have seen Rhode Island now is starting new testing. It's called the BIMAX test. And that test is rapid, and it's done through your saliva. So it's administered through the mouth. Instead of the thing that goes way up into your sinus cavities, this is something that you put on your tongue and you stick it in a little capsule and cover it, and you'll get the results in 15 to 20 minutes. So you'll see more and more of that being offered in Rhode Island. And that's more for asymptomatic people, people who don't have any symptoms, people who feel absolutely fine, but they could still be positive, as we know. And the governor encourages, I think she announced this 2 weeks ago, actually, that testing is open to anyone and everyone. Anyone in Rhode Island can be tested as long as you live here, and if you're a visitor. If you're a traveler and you come to Rhode Island, please get tested. All you have to do is go to this website. The name of the website is portal.rhodeisland.gov. Very, very simple. Go to that website. And the system just was improved recently. So it's very simple. Everything is confidential. All the testing results are right there. You can actually get your results. I've already taken 3 or 4 tests myself, and I can take the test and see my results online, which is so convenient. So we want to explain that in detail to the community, and we plan to do that. Lastly, the Department of Health and the governor have shared their frustration having to do with contact tracing. You know, when one person is positive, right away, we need to know who they were near, who might have been exposed, so that the Department of Health can call those people and say, please go get tested. And I don't know the percentage, but a lot of people don't answer the phone, or they hang up on the call, or they ignore the phone call, or they don't call back. So the government is begging you, and as the governor said this in her press conference, if you see a phone call from the Rhode Island Department of Health, I can't remember the exact number, but when you see that it's from the Department of Health, please answer that call. It's critically important, because you know, anyone can be affected. You have been affected by being near someone who is positive. So we're going to share this in a sign language vlog to the community, because that's so important. So those are the current updates. Back to you, Ernest.
Thank you, Mike.
Oh, if anyone wants to add anything later, please feel free, but we'll go back to Ernest for now.
And Tim is saying, I think we'll hold the comments till later. Okay. Thank you, Mike. I really appreciate you giving us the update on the pandemic. It's very important for all of us to know what's going on. And tomorrow, you know, there is a meeting, and then we'll have a little more discussion about that as well. Next on our agenda is the staffing updates. Okay. I wanted to let everyone know that there has been a change in the staffing here at the commission. Now, we invited Lindsay, we hired Lindsay
Conway.
and she's involved with the HSTP, and now she had left and then went over to take an interpreting position. So I wanted to thank her for joining.
She'll be our COVID coordinator.
And I know that we lost 2 staff members as well due to the new jobs that they received. Okay, and that was Thomas Darden. His contract was going to end this December 31st. And he realized that he found a new job, a permanent job. So I'd like to give, you know, the congratulations to him for that. And Lindsay also became our, you know, COVID coordinator. That's going to help us with that. Now, Christine West is the project coordinator, and she's going to elaborate a little bit more on that when she speaks. Okay, so those 2 positions, Lindsay and her contract was going to end on December 31st as well. Now, in terms of any of the other positions, Christine West and
Alexander
LaFair
Freer. Yeah,
is going to remain on with the HSTP project after December 31st. So they will continue to be here. Okay, so that's our staffing update. Now, what I would like to speak about is the HTSP update. So I would like to turn the floor over to Christine West right now so she can discuss about her project and what she's been doing thus far. Go ahead, Christine.
So I've got this, Simon.
I'll take Christine. And then I'll give it right back to you for Tim, okay?
All right.
Hi, good evening, everyone. Nice to see you. I have a brief update tonight for HSTP, but before I share my report, I just want to say congratulations again to both Drew and to David. Wonderful new additions to the commission, so thrilled to hear that. In terms of HSTP, we're really focused over these past few weeks on our 2 surveys. The first survey is the healthcare worker survey that's been disseminated to healthcare providers across the state, including those future healthcare professionals at colleges and universities throughout Rhode Island. That survey will close next Monday, December 14th. It's been circulating for quite a few months now. We have a total of 1,520 responses. So we're hoping to get a few more before we close next Monday. The other survey that we have circulating for a few months now is the survey for deaf and hard of hearing individuals, and it's our health survey. For those of you who have already participated, thank you for your participation. For those of you who have not yet taken the survey, please do. It's still available for the next 5 days. Again, that will close next Monday, December 14th. Our responses right now for the deaf and hard of hearing survey is hovering around 100 participants. The last health survey that was conducted back in 2008 had about 90 something responses, maybe about 90, 92 people who had responded. So we have surpassed that number this time, but we also still have 5 days left for that survey. So please spread the word, let folks know that it's available. Again, it's the first comprehensive online health survey that's accessible in both ASL and English. So please participate while there's still time left. If you need any assistance with that, please let me know. You can reach out to me or any of the HSTP staff, and we'd be happy to assist in any way. Again, that information that we get from those surveys will be helpful in determining what kind of trainings we have going forward for both healthcare providers and for the deaf and hard of hearing community. So it's extremely valuable information. And it's the first time that Rhode Island data will be included in a national data set under Gallaudet, who we've contracted with to design and develop that survey. So we're looking forward to receiving the results of those 2 surveys and moving forward with that. The only other thing I wanted to mention is that this Saturday, both Marie Lynch and myself will be sharing some ideas about the interpreting program at the RID meeting. And again, that's this Saturday from 10 to 12. So we'll be sharing with the interpreting community what we have envisioned so far, and looking for that necessary input from them. So we look forward to that. And finally, related to what Ernest had just mentioned, we will experience some changes in staff for HSTP. As you know, there's 4 original staff, and originally we were contracted until December 31st. We do have some available funds left, and we have submitted a no-cost extension request to EOHHS to continue our work. Most of our project deliverables are already complete. We just have a few items left. So certainly we don't need those staffing needs anymore. And we're thrilled to learn that both Lindsay and Thomas have other employment. So it'll be Alex and I moving forward into 2021, and we should hear about our no-cost extension request within the next week or 2, but it does look promising. Lastly, I just want to mention that we are looking for additional funding through the Department of Labor and Training. And so both Rick, Rhode Island College, and RICDHH, we will be meeting next week to talk about applying for another grant under the DLT. And so we're hoping that this will result in some additional funding for both of us to be able to continue some of our work. And that work will be different than the current work that we're doing right now. But I'll have more to share about that the next time we meet. And that's it for my report. Happy to accept any questions. If there are none, I'll turn it back over to Ernest.
Thanks, Christine. Okay, thank you so much, Christine. I appreciate you sharing the HSTP report. I'm so excited about this project and for our future. And I hope the no-cost extension is approved. I think we should be hearing soon from EOHS. It's looking good, and then we'll be able to continue our work and your work. Just looking at our agenda, interpreter referral services updates. I do want to explain something. We have an RFP, a request for proposal for our Tier 2 interpreter project We're working on that. We're hoping to come up with something soon. Once that is concluded, we'll let you know who the tier 2 interpreting agencies will be. These are private interpreting businesses. They'll be serving us here in Rhode Island, and they'll be eligible for MPA jobs. So if we can't find an interpreter from our regular pool of interpreters, we can then ask the tier 2, these private agencies, to help us out. And that will be a great backup and a great thing to have. We have a draft of a working document that Bethany has been developing on the policies and procedures manual. We're listening to the community about some of their concerns and complaints about interpreter services and their suggestions. We have been listening and working very hard to update our policy procedure manual. And we also are working hard to make our procedures transparent so that people understand exactly how we work. And then once people understand, we'll be able to also modify some of the request forms to make them easier to use and more effective to use, simpler to fill out. Right now, the request forms are very complicated and not effective. So we're going to simplify that process to avoid the confusion that we've been dealing with. We are interested in streamlining our procedures. We want people to be satisfied, and if they're not, we will definitely listen to concerns. It's not just us, we're also talking with Rhode Island RID, the Registry of Interpreters for the Deaf, to make sure that we're hearing what they're saying and to make sure that we're all on the same page. So we're working closely together to make sure that every decision that's made is a joint decision, and we're getting input from the people that are most affected. So we've been gathering, looking at documents that we have, improving documents as needed, and then we'll submit this document. We'd like to submit a document at our next commission meeting, not tonight, but a month from now, whenever our next commission meeting is set. We're hoping to conclude this process soon. And related to that, we are looking at VRI, how VRI might be utilized to solve some of the shortage of interpreters. With COVID, you know, a lot of people are doing distance interpreting, distance communication. And when you look at our policies and procedures, we haven't really accounted for VRI work. So we have a draft that we're going to be submitting as well on how to look at VRI work. That will also be shared at the next commission meeting. Holly, I don't know if you wanted to add anything to what I've just said. If so, please feel free to chime in. Holly says, no thanks, all set. Let me just make sure. Okay, you're all set, Holly. Thank you. I'm sorry. I missed that. All right. Thanks so much, Holly. Another topic that I wanted to raise tonight. I want to thank Pam because, my goodness, the work she's been doing, supporting the staff and being a real team player. She set up our virtual coffee hour and it was phenomenal. It was a huge success. I mean, even though it was different and it was online, I can't thank Pam enough for her work on that. What a beautiful job she did. And we are talking about future events now along those lines. Maybe we should continue with things like this on a more frequent basis. We can do something for Hearing Loss Awareness Month, Deaf Awareness Month. And like we did, like maybe our next year's coffee hour. Maybe we'd like to add more events. So we're going to be talking about that. We really want you to keep this in mind, that what we're planning to do is we don't know how long COVID will be with us, but the notion of virtual communication will probably still be with us. And it does allow for us to do certain things. So we're going to be focusing on various themes. Recently, we focused on
Racial
we're
justice.
looking at social justice and equality, and we've worked very hard on that during Deaf Awareness Month. We've brought up issues and had numerous conversations online and presenters to talk about their visions and their hopes. So how they want to, we've also thought about a lot about how we can improve our outreach to the community, to hear from the community, because we know it's tough. So people want to talk about the NAD president. And I know that Howard Rosenthal is the current president, but there's talk about whether we want to change the system or what we want to do about it. So there's a lot going on and a lot of struggles in the community. And it's not only for people who are Black and people of color, who are natives and so forth. A lot of people have so many gaps in their lives. They don't have computers, they don't have access. And we need to find ways to reach out and help people who are lacking that kind of access that so many of us take for granted. We really want to improve this in the lives for our BIPOC community members. And surviving COVID is one thing, but we have come to really depend on technology for access. So we've learned a lot in these times, and we want to make sure that we improve access to the resources necessary for the deaf and hard of hearing community, especially BIPOC members who don't have the necessary equipment, who want to work. And we need to develop better services through NAD and other organizations to provide access to technology. So we're looking at ways to improve that so that people have access to technology that, as I said earlier, is so critical. And I can imagine this in the future, it's only going to become more important. So we're really going to look into ways, and we're meeting with, in our strategic planning, we're brainstorming on how we can meet this tremendous need so that BIPOC individuals can handle the issues that they've had for years, but now are worsened by COVID and the huge dependence on technology. We want things to be fair, and we want access to be widespread. So there are barriers, and we need to really attack those. So that's something I just want folks to keep in mind. And then lastly, Christine was talking about looking at grants for to continue the HSTP program. And we've been talking about this with Christine. We're going to be very assertive about finding grant money. We will look very rigorously. And we want anything we can do to help deaf, hard of hearing, and deaf-blind people improve the quality of life in Rhode Island. We will do it. So we've talked about the Commission on Disabilities and networked with similar agencies about what can we do to get grant money? What's required? What sort of things do we need to do to be suitable for these grants? And the good news is, URI, there's an individual at the University of Rhode Island who wants us to be her, who has a consulting fee, but she has a program on spinal cord injuries. And interestingly, she's including disabled people in her study, including deaf people and hard of hearing people who have spinal cord injuries, and how that pertains to employment. And so we've reached out to the community. One of the issues we already know is access. Another one is maybe someone with a spinal cord injury may not be able to sign. They may need to have equal access in some other way through an interpreter or some other kind of technology. So we were asked by this consultant She offered interpreting services to make a video to include deaf people. And we could send this out to folks. And we would have a certified deaf interpreter actually sign on the video. And it would focus on access, and it would have a number of survey questions. And we had such a great experience with the Gallaudet survey. So we're gonna use that strategy, because the way it was delivered to our community, and Christine West, she was so impressed with it that she convinced us to go with it. It's so accessible to deaf people. So we're gonna keep looking for grants. We're gonna use the survey model that we have through Gallaudet, and we're gonna look for more resources and more awareness in Rhode Island. We want to show people that we care and that we're motivated, and we're here to help deaf and hard of hearing people now. We know big changes need to happen, and especially for deaf, blind, and hard of hearing people when it comes to access. So that concludes my remarks. Thank you all so much for listening. Your microphone is off. Thanks, everybody. And Amy, I believe you had a comment or a question. If you'd like to go ahead and ask your question.
Yes, I have a few questions. Okay. And this is a question for Mike Bear in terms of, what the process is going to look like in terms of who already contacted, in terms of who's going to be getting the COVID-19. How do we contact these individuals? How can they, where do they contact? Okay. So, and there's also a follow-up question related to that. So and Tim is saying, are all your questions related to Mike Bear? Well, actually, they're for both Mike Bear and for Ernest as well. Okay, well, when Ernest goes on, then you can ask him, because, it's related to his report. Okay, and so I just want to identify who the questions are going to be so that we can identify the person who should be responding to you, okay?
Hi, I can answer your question. Hi, Amy. Can you see me? Yes, I can.
So my question is, what exactly is the process, when they get that information? Because recently there are people, that have language deprivation. They're not aware of the information that's related to COVID-19. Okay, so there's a lot of, staff that were exposed in courthouses, and that was an example. And so those people that have language deprivation, well, I don't want to say but they were unaware of it. And so these people need to know what their responsibility is when they're in an environment where they've been exposed to people who tested positive in a courthouse, for example. So who would they report to? In other words, if they become positive, they need to know that. So how do they go about that?
Thank you for your question. That's a huge, it's a huge issue, and it's national. It's not a local thing. Access, and with people with language deprivation, that's also not just a local issue, it's a national issue. We definitely, folks need to use a CDI. Maybe you could tell me more about your question. Are you talking about contact tracing?
Yes, but I can probably get in touch with them a little bit later on, but I just want to know if the commission knew anything about this right now in terms of this problem that just happened recently at the courthouse.
We had a meeting with NAD, and they're already seeing on a national level issues with contact tracing. People simply aren't aware of what to do. They don't have data. They don't have statistics. They don't. In the deaf and hard of hearing community, they're left out. They're not able to really have the same access that so many of us have to the information that we need. So equal access has not been occurring around the issue of COVID. And yeah, they do need to provide equal access, but it's been so long. What is it, 9 months now? So a plan is being developed for this situation, this concern, but I agree, we really need to pursue getting information. And I know Bear is developing scenarios and a dialogue with the community. So it's something we're aware of, we're studying, and we're concerned about it too, is folks with language deprivation getting the message.
And that's good to know. It's at least that's a good start.
Okay, great. Ernest, why don't you stay on? The next person is Alex Balsley. I believe it's Drew Balsley. I think it's Drew, yeah. I'm Drew. I'm using my husband's computer. That's why it says Alex. Okay, great. So I did have a question. It's also about COVID. I wanted to get a clarification, not just for me, but for other people. You talked about rapid testing, the bio thing. Oftentimes, a lot of people will talk about these rapid testing, you get your results in 15 minutes, but is that the antibodies, is that if the antibodies have been in your body for a couple of weeks only? You might get a negative, but actually, well, what I'm worried about is maybe you caught the virus yesterday, but you've been negative up until yesterday. Can you explain the difference between the tests? Because the antibody test is one thing, but a test, that would show that you had the virus, that's one thing. But people are talking about the holidays and they're like, no, you're fine, you're fine. It's like, no, wait a minute, wait a second. They don't seem to fully understand that just getting tested doesn't mean you can go anywhere you want for the holidays. I think a vlog that would talk about the different kinds of testing and what they indicate you can and can't do.
Yeah,
Yeah.
and I'm going to let Mike Bear, I'm going to refer to Mike Bear to answer that question for you. Mike? Yes. Hi,
Hi, Becky.
Drew. How are you? Okay, before I answer your question, I'd just like to go back a little bit to Amy's question. Okay, do you mind? Thank
Sure,
you.
no
I really
problem.
appreciate that. So you can turn your camera off for a second. Amy, do you mind coming back on, please? Thank you. So, Amy, I want to make sure that I understand your question, okay? So you're talking about a deaf or hard of hearing individual who is already positive, but they are unaware that they are positive, and they continue to go out and they become a spreader. I wasn't quite sure if that's what you were referring to, or were you talking about a deaf or hard of hearing individual who doesn't understand if there's another individual besides themselves and that they need to stay away from that person, so they should be in their association? So it was kind of hard to follow you when you were saying that.
Actually, mine was more related to how do people in general, deaf, hearing, anybody, when people get tested, how does the contact tracing work? How do they let the people know around them that they've been tested and positive? How do they get the word out, so for the contact tracing purposes? Because I do know of people who test positive, they don't tell anyone that they may have been exposed because they don't realize they have to. If I find out, then I can tell people. So that's
Okay,
what I was
thank you.
getting at. It's
Now
all
I
about the
understand.
contact tracing. That was my point.
Thank you.
Okay,
Now
can I
that
close my
clarifies it.
camera now?
So I'm going to answer both of those questions for you, Amy. First, when an individual takes a test and they are positive, the Department of Health is the first agency to know about those who have contracted the virus. They contact the person who has the virus, and then immediately when they get a hold of that individual, they will begin to ask them, where were the people that they were in contact with within the last 2 weeks? So they gather that information and then they place those calls. That is part of the contact tracing, where they notify those people that you have been in touch with or in association with a person that tested positive. So it is expected that those individuals that are notified will self-quarantine. That is the process that the Department of Health uses. Now, I've already met with contact tracing team. I believe it was back in August, and I reached out to them and I wanted to make sure if they had contacted deaf individuals in the community. They said they had not. So now it's December. And so I think it is time for me to reach out to them again and see if there is a need for us to give them our support so that they can develop a process so they can know how to reach out to these deaf and hard of hearing individuals so that they can advise them that they've been in contact with someone who was positive. Go ahead, Amy.
Okay, yeah, I understand that part. I appreciate your clarification. So I'm thinking of a specific individual who, without an interpreter or a CDI, there's no way, conversation would be effective with this individual. So I found out kind of, the person's clueless. I mean, I don't know how else to say it, and I'm guessing that it goes back to some people have severe language deprivation, and getting someone to contact them through video phone could be problematic. It has to be the right team of interpreters, a CDI and a sign language interpreter. It could be someone from another, it could be language deprivation because the individual's from another country. I can talk to you more about this, Mike, this specific situation. But
Yeah, let's talk a little bit. Let's take that offline. I'll talk to you a little bit more about that because I would like to have this discussion with you about this situation, okay, offline. Because the Department of Health really needs to realize this situation that you're speaking about. Because we're talking about life and death now, okay? So thank you for sharing that with me, Amy. Okay, back to you, Drew. Okay. Okay. So now, Drew, you were talking about the testing, correct? Okay, the Bimax and the other one. That was an excellent suggestion which you brought up. And I did document that just now and I put that down. So what I'm going to do, my department will basically create a vlog to explain to the deaf community what the difference is with the two different tests in between. And so what I was thinking about, now that you brought that up, I'm going to follow up with that for sure. I'm definitely going to create a vlog for that and get that out there on the website to disseminate that information to the community. And thank you for that suggestion. That is so important for the community to understand the difference of what you're speaking about, because it does become very complex and hard to understand.
Yeah, a lot of people have difficulty when they first read the results, and then, things over time, information changes, and I just don't know that it's getting out to the general public. I just want to make sure people understand, because I know, some tests take time. And so I think it's still an issue. Many people are misunderstanding information about testing. And if it could be more visual, you could show the test, what it looks like, whether if it's for children or others, you can have different categories of people that you address your comments to, but you want to make sure that people are empowered. And I think having a CDI is a great start. And I'd be very happy to help out and be included in this.
Yes, thank you, Drew. And it was difficult even for myself at first. Now, Tim, back to you.
Did you have a question, Christine? I saw your name.
Yes, I do have a question for Christine West. Thank you. Christine. Hi, Christine.
Hi.
Christine, I had planned on asking you this quite a while ago. Can you clarify when we talk about HSTP and talking about the interpreter training program, the interpreter training program at the time when you were doing the work with HCSP with Rick? My understanding was that this is not an interpreting training per se, but it's more of a less, it's focused on health care in terms of terminology, signing and so forth. I'm a little concerned about that because I'm beginning to see you and Ernest and the committee, and there's no fault of your own, by the way, because when you refer to it as interpreter training, but I know in reality, it's not an interpreter training program per se, but it's more of a certification program or certificate program. Has anything changed from that? So I just wanted to ask you that to make sure that we're all on the same page when we speak about the interpreter training program, when we address these issues to the community.
Sure, I'm happy to answer that, Mike, and clarify. Let me just give you some context. In terms of the HSTP grant, you know that there's 3 primary goals. The first is data collection. Those are the surveys. The second is workforce training. That's training for healthcare providers. And the third goal is to establish an interpreter program. We have called it an interpreter training program because, yes, it's considered a certificate program right now, as opposed to an interpreter education program, which would connote more of a 2-year or a 4-year program, resulting in an associate's degree or a bachelor's degree. So technically, this is an interpreter training program, and folks will leave with a certificate. Now, one of the difficulties that our advisory group has been assembled to work on this, one of the struggles that we had is that the grant stipulates in the project proposal that this program must relate to healthcare. So therefore, the interpreting program must address providing added capacity for medical interpreters. That was the stipulation of the grant. At the same time, we know that the community has cried out for a program to cultivate new generalist interpreters. And so trying to include both of those things into one program, we realized is very difficult, because we know that when we create or cultivate new generalist interpreters, at the same time trying to incorporate medical expertise, it's very difficult. Entry-level interpreters doing medical interpreting, even though that happens, technically medical interpreting is more of a specialization, or at least should be viewed that way, in the same way that legal interpreters are viewed. And so we realized we couldn't incorporate those both together. So what we've decided as a group and as a community is to have 2 phases. The first phase will address the requirements of the grant, which will be a certificate program for those interpreters who are already screened, already certified, already working, but want to specialize in public health interpreting. And there'll be a strong focus on equity and social justice as a part of that program. The second phase will be to create a generalist program for new interpreters. And we're hoping to accomplish that after this first program is established in June of 2021. So we see it as a 2-phase project, and certainly it's going to depend on funding that's available, but that's how we've been able to address both needs, both meeting the requirements of the grant, providing medical interpreters or healthcare interpreters, and then also being able to cultivate new generalist interpreters for the community. I hope that answers your question, Mike.
Thank you. It does. Beautiful, loud and clear. Thanks so much, Christine. I got it now. Okay, thanks everybody. So moving right along. We have 3 different committees. We'll go ahead and hear from those committees. We have the Education Committee, our Employment Committee, as well as our Healthcare Committee. I want to focus on the Education Committee. We were supposed to meet in November, but we hadn't filed 48 hours in advance with the Secretary of State, so we had to reschedule that meeting, unfortunately. And we'll be meeting January 14th, which is a Thursday. We've invited Sharon Applegate. Sharon is the CEO of Deaf Inc. in Massachusetts. She'll be presenting to us on how we could establish something like a Deaf Inc. here in Rhode Island. We really want to replicate that. So that's what that's a brief summary of the report of the Education Committee. The Employment Committee, I'm sorry, do we have someone here who's prepared to report on that? Brett, you're healthcare, right, Brett? Who do we have on the Employment Committee? Betsy, if you don't mind reporting, that would be excellent.
The Employment Committee is meeting tomorrow. And we are going to start working on a second job fair that we hope to have in the spring. It looks like it'd be good to have it in May during Deaf Awareness Month. And with more lead time, we should have a greater number of participants and employers, and we should be able to set it up to have some preliminary interviews happen after directly after the presentations by the companies. And I think the other thing we talked about is perhaps involving college students and Rhode Island School for the Deaf students in the job fair, because they would perhaps at that time be looking for summer employment. It would be students looking for summer jobs. So we're well on our way. Whoops. Phone's ringing. Yeah. And we intend to meet tomorrow to start working on that.
Okay, thanks so much, Betsy. And then Brett, if you don't mind giving a brief report on the healthcare subcommittee.
Hey everyone, how are you? So basically, we didn't meet in November. There was a lot going on, and then we just met last week as a group, and we kind of wrapped up calendar year 2020. I think everybody was trying to wrap up the year as quick as possible, so we decided to do it last week. So basically, what we talked about was Christine's team. They talked about how they had a 2 survey and that they would be wrapping up by the 14th, and they should get the result by the 18th from Gallaudet. And then we continue to talk about some goals for calendar year 2021, which includes the biggest priority is the interpreter training program with Rick, and Christine will be meeting with Dr. Marie Lynch. And we also have some other priorities, including community outreach and virtual training, I believe. And we are currently in the process of scheduling our next meeting for mid-January, probably the first or second week of January. And we are planning to invite 2 people from the Executive Office of Health and Human Services to talk about the ecosystem that they, the ecosystem project that they have and how it might apply to the HSTP project in terms of data mining and what kind of information we can get from them to use for ourselves and for interview strategies. And that's kind of where we are. And yeah, we'll meet in January.
Thank you so much, Brett. I appreciate your report.
No problem.
Okay, I think we're all set with reports. We do have a 4th subcommittee. It hasn't started yet. We have some technology access and community communication relay services. We'll get to that very soon. I mean, COVID has forced us to put certain things on hold. So that's old business. And let me just see what we have on our agenda. The first thing I see is a needs assessment project. We have met with a consultant, and that's Sean Feldman. He has a company called Inevi Strategies. He's been connecting with different commissioners and attending different meetings and is assisting us in developing a big picture, a large scale plan on what we need, where the most help is needed in terms of getting information out there. We might need more new projects, more new services. So Shane is helping us to identify those. We'll have another meeting with Ernest, myself, and Carolyn Obrecht, our vice chair, to talk about that. After the next meeting, I'll have more to report to you. Yesterday, we had an executive board meeting or executive committee meeting. That was myself, Carolyn Obrecht, our vice chair, and Brett Hayes, our treasurer. We also had Betsy Beach, our secretary. Hi, Betsy. So we brainstormed on developing a draft of, let me get the right wording here, an executive director evaluation. This is an evaluation that we've shared through email. We're looking at something that is feasible and something that everyone will have access to. It was actually developed in 2012, but boy, it was very detailed. It was an evaluation that may not have been very practical. So we're revising our plan to something that's simpler. We're going to measure 8 areas of job performance. And then that will come up with an overall summary or score. The 3 measures are exceeds expectations, meets expectations, or below expectations. And then there will be comments in each category, each of the 8 categories. We'll identify 3 successes, we'll identify, or strengths that have been accomplished in the previous year. And then we'll identify recommendations for further development, goals for the future. And that'll pretty much be the entire evaluation. Once that's available, we'll be able to show it to you. We can upload it. The state actually has their own system. And it's easy for people to simply check off the boxes and type in their comments. And it'll make it easier for us to gather that information to complete the evaluation. So it's more technology than the old paper evaluations that we used to do. The evaluation was or should have been October 15th. We started collecting the data prior to that. So Ernest started his job a year ago, October 15th, and we're going to be measuring his performance after the, we have to go by the fiscal year. So that'll be after June 30th. And so from July 1st onward. And we'll measure, they do evaluations of our executive director annually based on that schedule. I wanted to show you what it looks like. I'm going to see if I can do that right now. I'm hoping I can do it. It doesn't look like I can share this, unfortunately. I'm sending a PDF. Bethany, I'm wondering if you can possibly share that document on the screen for everyone to see.
Yes, give me one moment.
Okay, great. Okay, this is what we'll be working with. If you look at the top paragraph, this evaluation is for, it says October 15, 2019. And obviously the point being that it looks like it starts in October to October, and then the second year evaluation will be October to June 30th. And then in 2021, it'll be July 1st. I'd like you, if you scroll down just a little bit, you can see the different areas that we'll be looking at. And there's a board policy manual that includes the job description. This is our simpler format. Like I said, it takes 8 categories and just breaks them down into 3 possible measures. Exceeds expectations, meets expectations, below expectations. And then you can see, if we can scroll down to the second page, Bethany. At the very bottom, it talks about self-assessment. Yeah, that's what I wanted to show. This is an overall summary of accomplishments throughout the year. So there's a self-assessment, and we're asking Ernest to pick the top 3 accomplishments during the year. And then the development plan would be a next year plan. So if everyone is happy with that, if you don't have any objections, if someone could make a motion to approve this evaluation, if you feel that we should change this or discuss this, now would be the time to speak up. The full description of each of those 8 categories, as I said earlier, is in the job description of the board members. You each have a board handbook. Would anyone like to comment? Any of the commissioners care to comment? Sorry, I'm having trouble seeing everybody. Let me just change my view here. Okay, this is better. I have the gallery view on. If anyone had a comment from the commissioners, I'm happy to entertain them. Or if somebody would like to make a motion, this would be the time. Betsy.
Your voice is off, Betsy.
It's terrible. I think it's simple and straightforward, and I think we use it. We can always tweak it and modify if after using it, we learn something that we want more of or less of. But because there's room for comments and kind of a simple form of evaluation, I think that's good.
Okay, other commissioners care to comment or suggest a revision? Or if you feel like it's good, let's go ahead and go to a motion to approve using this format for our evaluations.
So I like this evaluation tool. I was at the meeting yesterday, so I saw some of the others possibilities that were not at all workable in my mind. So I would like to both recommend this to everyone, and I would like to make a motion to accept this evaluation tool.
Okay, we have a motion. Would anyone care to second the motion?
I agree with Caroline. I do think it'll be a good tool for all of it. I'll second that motion.
Okay,
Sorry.
thank you, Brett. Okay, so Caroline Obrecht has moved to accept this format. Brett has seconded. Now all we need to do is vote. If there's any discussion before the vote, now is the time. If anyone cares to discuss it. Otherwise, we'll just move right to the vote. Okay, I don't see any discussion. All right, so all in favor, just type in chat or feel free to just do a thumbs up. Okay, Betsy, Brett, Kimmy, Caroline, Boonmi, thank you. We're good. It looks like everyone has voted to pass this unanimously. Very good. So we'll start using this evaluation. The next step will be to actually set it up in NeoGov. Rhode Island is a Rhode Island state system. So I'm going to use their already set up system. And I'll look into that. This will be the first time in a long time that we've conducted an evaluation of our executive director. And this will be completed. I mean, this will be concluded and then it'll serve us until June 30th. 2021. All right. Yesterday, we had another discussion in our executive meeting. And we wanted to clarify the role and function of an ad hoc advisory committee on the interpreter referral service. The purpose of the committee, the goals of the committee, timelines, and some of the measurements, the scope of work, when it should be completed, and who should comprise the membership of this ad hoc committee. And we also came up with the notion of having ex officio members, and that would be the staff that works in the interpreter referral service. And also members that might be able to, they would be considered automatic members. I'm going to try to show you the document. Again, I need to ask Bethany.
Allow me to make you co-host, Tim. I'll make you co-host and then you should be able to share.
Yeah, that might be easier. I was going to send it to everybody, but yeah, if we want to do it in the open, that's fine too. Everyone has access to a copy. If you want to go ahead and share it now. There we go. Beautiful. Oh, wait, that's the last one. Do you have the other one, the ad hoc committee on the referral service?
I am downloading it right now. Give me 1 second.
Okay, gotcha. Okay. So this is it. I just want to summarize this. I won't be reading it to you. The purpose is to identify areas of improvement for the quality of the interpreter referral service. We have 3 specific goals: to develop procedures for quality control, to resolve issues from consumers, interpreters, CART providers, so that the procedures are clear and understandable, that the policies and procedures will be updated and make them current, and to make sure that the quality is consistent. I'm trying to see if we want to identify any gaps or challenges that the commission faces and try to resolve those. So those are the 3 primary goals. As far as the timeline, we think this should be concluded between, well, it's because of COVID, we were thinking 6 months, but we're going to say 6 months to a year, just to give a little flexibility there. Should be able to be done within the year. As far as scope of work, we'd like to see a flow chart of the process, the beginning of a request, and what happens to the request all the way through the assignment of the interpreter. So we'd like to see how that flow works visually. we want to get a sense of who are the interpreters that we have available, who is licensed and actually willing to work in Rhode Island, maybe part-time. Maybe they're doing less work. We want to identify what we have available in terms of our census of interpreters. Thirdly, we want to gather feedback and advice from our consumers, interpreters, and CART providers, including advocacy organizations like Tri-County or the Rhode Island Interpreting Group. We'd like to get advice from other agencies and see how they're doing, what their interpreter referral services look like and how they're performing. And we'd like to review and make recommendations for specific policies and procedures. And then develop materials in both American Sign Language and English that we can share with consumers so that they understand the process, including how to file a complaint, or if there's an issue or a problem, what's the appropriate procedure? We want to make sure everyone is on the same page and that the process runs smoothly so that we can solve problems. As far as who should comprise this committee, you'll see that some of these may be overlapping roles. We can have 7 members, and that would include somebody from Rhode Island Association of the Deaf, a representative from Rhode Island Registry of Interpreters for the Deaf, someone from the Rhode Island Hearing Loss Association of America. They represent, in terms of issues with CART providers. The law requires that the committee have at least 1 commissioner. Tina is one of our commissioners, and I know that she would be happy to probably serve on this committee. And then we want to have a deaf person, a consumer, at least one hard of hearing person, and at least 1 licensed interpreter in Rhode Island. So we want this to be diverse. We want to hear everyone's opinion. We want people who are eager to be involved, and we welcome you. So we'll be getting feedback from the community. That's the members will be doing that, not from the members of the committee, but we will be asking for advice and feedback from the community. And then, as you can see at the very bottom, we have ex officio members, and that would include Ernest Covington, or the director, executive director of the commission, as well as the interpreter referral specialist. If needed, other experts can be included as well, but those 2 most definitely would be involved as ex officio members. So we can go ahead and close this down now. Thank you, Bethany. Any discussion on this, the composition of this subcommittee? If people are happy with it, someone is, please make a motion to accept it. Christine.
I just wanted to share some thoughts on this. I saw in one of the goals that it mentions having an updated census of interpreters in Rhode Island. And I was just wondering if folks had given thought, and maybe it's beyond the scope of this particular ad hoc committee, and it could be something done either in tandem or subsequently, but drilling down even further, looking at our interpreter workforce and doing a full comprehensive workforce study on both interpreters and CART providers. So not just identifying who we have, who is licensed in the state of Rhode Island, but also looking at age demographics, racial background, also a variety of other demographics that can help give us an idea of who do we actually have here in the state who's eligible to work. And taking a look at that whole pipeline and seeing, okay, maybe we've got 5 or 6 interpreters who are in their 60s and will be retiring in the next 5 years. What does that mean for the state? And how can we use that data to either push for new programs or push for additional funding to be able to address some of those gaps in the workforce pipeline. So, or maybe we're seeing that we don't have a lot of interpreters in their 20s. So what are we doing to address that? How are we recruiting more people into the field? So really drilling down to those demographics to get an accurate picture of what we have. And then we can also project into the future, what do we need? Taking a look at some of the labor market information, taking a look at the requests, taking a look at different geographic areas around the state, identifying where interpreters exist there, taking a look at the different industries and where interpreters are needed most. We know in medical settings, and we are working to address that now with HSTP, but doing a full workforce development, planning, analysis, and strategy, and being able to take all of that information, and that can certainly help to inform the strategic planning that Shane is doing as well. So I just wanted to put that out there as just some food for thought, whether that's beyond the scope of this particular ad hoc committee. It's quite large to conduct a workforce study like that, but I just wanted to put it on people's radar for something to think about in the future.
Thank you, Christine. That might be something that we add. That could be a revision, or that could be something that the ad hoc committee includes as part of their work. So I'd be interested, I don't know if we want to add some language, or do we want, with what Christine shared, I'd be more than happy to revise the description of this ad hoc committee to accommodate what Christine just said.
So I like the word that we use, census, in terms of seeing who's out there. And it's my understanding of census that it can incorporate some of the information that Christine was asking for: age, location, ethnic identity, etc. So I think we can include that. And I think the workforce study seems to me like that is a great idea. But I don't know that this ad hoc committee is able to take that on at this point.
Okay. Thank you, Caroline. Other comments? Any other comments about what we've just heard? Betsy.
You're muted, Betsy. You're muted again.
Betsy, your microphone is off.
Your microphone is still off.
I hate, oh my gosh. It seems like the employment committee would be very interested in that question as well. It's a workforce issue. I don't know, I think I think perhaps this committee could make a recommendation for how to set up that kind of comprehensive workforce study. Maybe not actually carry it out, but be working towards thinking about how to do it. Because our committee, the employment committee, has tried to emphasize access as we do everything, and thinking about issues of access in the workplace. So I'm just wondering if we can't head in that direction, even if we can't complete that big a project.
Okay. Any other comments? Or do you think we're ready to entertain a motion? It's a quiet group out there tonight. The word census can be inclusive of some basic demographic information. Betsy, yes.
You're muted, Betsy.
I think that I want to move that we accept this draft proposal for the new interpreter referral committee. I think it's I like the way it's worded still. I think it's enough for a good beginning for the next 6 months to 1 year. So I propose that we accept it, move that we accept it.
Thank you. Do we have was that a motion, Betsy? I'm sorry. Kimmy, yes.
Yeah, that was a motion.
Kimmy says, I second the motion. Okay, so we have a motion and a second from Kimmy. Betsy, you made a motion, correct?
Yes.
Okay. I just want to make sure. I want to get the motion language just for clarification so everybody understands the motion. If you don't mind repeating it. Because we had motion and discussion kind of embedded. So if you don't mind just making the motion again, please.
I move that we accept the proposal for the ad hoc interpreter referral committee for the next 6 months to 1 year.
I second the motion. This is Kimberly. Okay, so we do have a motion and a second. Kimberly, thank you. So it's time to vote. Go ahead and vote by using the chat or just giving us a thumbs up. Carolyn, Brett, Betsy, have you voted? Kimberly, Betsy, oh great, there's your thumb. Boomy, great, we have 5 and I'm 6. So the motion carries. That's great. So it's like we're all set to move on. Certainly by January, we'll have the subcommittee up and running, January 2021. So we're going to go ahead and start reaching out to members of the groups that we mentioned to invite them to join this committee, and then we'll approve that and then go from there with our new members. All right. Brett, did you have a question? I see your video is still open. Sorry. Okay, so we have, okay, unfinished business is now finished. We've already given the updates of our 2 new recommendations to the governor for this commission. We're just waiting for formal appointments. Unfortunately, we commissioners don't get to appoint ourselves, so we have to wait for the governor's approval. After that, we'll only have 2 more seats for a deaf consumer who uses ASL. That will be open. And we're going to try to do more outreach and more recruitment to get folks to apply for those 2 empty seats. So hopefully we'll have a full board and we'll be able to announce, we'll do a nice vlog about it. Okay, and we'll get Ernest to help us out with that for sure. Now, new business, we have 12 minutes. I think the most important thing is that we approved our plan for 2021. Getting information out to the public, our plans for meetings so that you'll know our meeting schedules. We have a draft. And I believe, Bethany, do you have that draft, or is that something I should upload? Let me see if I can get that to you, Bethany.
I do not have it.
Okay. Okay, I sent it to everyone who's here at the meeting tonight, so you have it available to you. If you can share that, Bethany. Great, thank you. Typically, we meet on the third Wednesday of every month. You seem to like that time, 4 to 6, but I want to see if you want to move it to a different time, a later time. And do you prefer the earlier time or the later time? And then you see a couple of anomalies here where we could reduce a few meetings because there are an awful lot of meetings. So we may not have all of these. Like September 15th, that's a Jewish holiday, Yom Kippur. It's very likely we'll move that to a different date. September 8th. Are there
I'm not hearing the interpreter speaking, please.
Yes,
okay?
Carol Fay has frozen.
Oh, I'm frozen still?
You're fine with me, Carol. I can see you. Maybe it's on her end.
All right, if you could just take over the interpreting until I,
The audio is back and you're back. You're fine now. Your audio had frozen.
yeah, okay.
Do you mind taking this screen share off, Bethany? Thank you.
There we go. Okay. Any comments about, first of all, the time? Do you prefer 4 to 6? Or do you prefer 5 to 7? Or do you want to do 6 to 8? What works for you? I'd like to see what you guys are thinking. Go ahead, Drew.
I just want to let everybody know, that I have to drive. I'm not working remotely like most people are. And so I usually leave from work and get back in. I get here after 5. So 6 o'clock works good for me since I have to commute. And so I don't have too much where I can, change my scheduled time. However, I can figure it out and make some adjustments if it's not agreeable to everybody else. But 6 to 8 does work for me.
Other commissioners, do you like 6 to 8? Kimmy says, yes, I prefer 6 to 8, actually. Okay. That's fine. That's fine. I can do any of these times. What about others? It looks like, oh, sorry, Caroline, go right ahead.
I can be flexible, so 6 to 8 is fine with me. So if that works for the majority, I'm totally on board with that.
Is there anyone who says, gosh, I really can't do 6 to 8? Betsy?
I'm the same. I'm flexible. I actually was enjoying the earlier time, but I'm totally flexible. And if other people need 6 to 8, that's fine with me.
Okay. So far, people seem to prefer 6 to 8. Are there any objections? Is there anyone who really can't do 6 to 8? If I don't hear any objections, we probably will go ahead and keep that time, just like tonight. And then the dates, for example, in the summer, especially July, August, those can be a little bit sketchy. A lot of people take vacations then. So maybe each month at our meetings, we don't need to meet every single month. We've already exceeded what we're required to do. So we're in good shape. But we always have great discussions. And who knows what's going to happen with the virus. Does anybody have a comment about the schedule that we've shown you? If there's a cancellation, we let people know well in advance. We're not stuck with any of these dates. And certainly if we need to add a special meeting, we can, but this is for general information. It's not anything that we're bound to. Betsy, go ahead. Just turn on your mic.
I think we should definitely get off of Yom Kippur because that would cut out a whole segment of the population not being able to attend the meeting. And it needs to not be not Yom Kippur. I think that we go with September 8th and just take the 15th off.
Okay. Yeah, we'll have that meeting on September 8th instead of the 15th. Great. If everyone's satisfied with that, why don't we go ahead and have someone make a motion to approve that schedule? And then we can release that to the public for 2021. And we can book interpreters and cart and be ready well ahead of time. Everyone will know and they can plan their schedules accordingly. Carolyn.
So I move that we accept the schedule as printed with the Yom Kippur revision.
Great. Do we have a second? Kimberly. Thank you for seconding. All in favor? We have 1, 2, 3, 4, 5. Betsy, I don't see Betsy. 6. Beautiful. So it's unanimous. Everyone's in favor of the schedule. So we will release that to the community with the exception of September 15th being changed to September 8th. And the time will be 6 to 8, not 6 to 9. So that's another change. So we'll get that information out to the public. All right, now we have 2 minutes left. I added a third item of new business. I wanted to plan ahead for legislative needs, for bills that we might want to introduce to our legislators and advocate for. With COVID right now, that's just not feasible. It's just not a good time. So we're going to put that on hold for the time being. In January, we can revisit that. Perhaps Ernest, if there's more research about what commissioners might be able to do, how we could be helpful, how we could partner with other associations or organizations or agencies, just let us know. For now, because we are out of time, we'll have to hold off on this discussion until the next meeting. If there are any concerns with postponing this discussion of the last 3 items, the plan for introduction of bills, the community partnership education awareness for 2021 and different events. And then lastly, networking with our senators and state reps about activities and issues that impact the deaf community. If you're okay with us putting off those discussions until the next meeting. If everyone has no objection, I'll take that as a okayness and we'll just move on. Do I hear any objections? No. Okay. Are there any announcements that anyone would like to make before we wrap up tonight? Betsy.
I think Brett Hayes is getting married soon, so I want to congratulate him.
Thank you. I appreciate it. Get married on Saturday. Well, eloping, yeah. Well, that's just COVID, right?
Oh,
Yeah.
that's great, Brett.
Thank you. I appreciate it.
Good. Well, congratulations to you, Brett. I believe we're all set for tonight and we are going to wrap up. It's 8 o'clock on the nose. If everyone doesn't mind turning on their cameras, we can just say hello and goodbye to one another.
Take care, everyone. Bye-bye.
Bye, everybody.